All right. Dr. Shukla, thank you for being here and talking with us today. You kind of, what really rung in my head for many weeks was after the Firefighter48 event at Sunbar, and you're up on the stage and talking about stuff. And you said that for every 100 firefighters, you're finding between 10 and 12 cancers now. And that's a scary percentage. What is, like, if you took a random sampling of adults, uh, how many would you expect to find out of 100?
So usually with the 100 general population, we're finding 1 to 2 cancers. And so for firefighters, in my data, we're almost 10 times higher.
So, and I've seen the statistics that are out, and I don't even know the source of them, where it was like firefighters have a 9% higher chance of getting cancer and a 14% higher chance of dying from cancer. But it seems like those numbers maybe need to be, aren't current, right?
Well, yeah, those numbers are old. So that is from data from like 1960 to 1988 or something like that.
Oh,
And
wow.
so there's been no recent publications that show comprehensive the epidemiology, the incidence of cancer in firefighters. So that is something I'm working on. I have 5 years of data that I'm hoping to publish soon.
Oh, wow, that's great. Because, even when I see, I don't know if it's IAFF or other groups, and they post this graphic,
Mhm.
firefighters have a 9% higher chance of, I don't think that really creates a lot of empathy. I think people are like, okay, 9% higher. But I think the real numbers would probably make people pause and go like, holy crap.
Yeah, I also think the fact that the firefighters are getting cancer so much younger,
And
that
rare
Mhm.
cancers too.
yes.
Yeah.
So that resonates with the population because you see a 44-year-old with prostate cancer, that's not common. You see a 39-year-old with kidney cancer, that's not common. And so,
28-year-old Mesa firefighter with Hodgkin's lymphoma
yeah.
who never was on a prescription med his entire life, never ever sick in his life, and then suddenly he's got cancer. Yeah. Yeah. So get us up to speed on like where things are at right now. Paint a picture of what's going on with firefighter cancer right now. Maybe some things that are going on in Vincere. I know you were talking about get that MRI machine in and stuff like that. But get us up to speed on paint a picture of firefighter cancer right now. What are you seeing and what concerns you?
So, I mean, the biggest thing is what I'm seeing is younger and younger cancer. So, about 2 weeks ago, I seen a 32-year-old with a big mediastinal mass, which is likely going to be a cancer. There's so many young firefighters, and so I'm most excited about our MRI, which is a 3T MRI. So a lot of the places that do screening use a 1.5, but the reason why like a 3.0 MRI is so much more important in firefighters is that is the same type of scan I do in a cancer patient. The only difference will be is contrast. And so if I see something in a firefighter, I'll be able to give them contrast and come out with a diagnostic cancer scan. And so that is going to be a game changer because firefighters, I'll tell them to do scans and they forget to do scans. And it's hard because everybody's busy getting into an imaging center to follow up. Sometimes the copay is very expensive. And so being able to do that real time where looking at the MRI, I see something in someone's brain. I say, we got to keep you on for another 10, 15 minutes, do a little bit of contrast, and we can figure out what it is right then and there is going to be a game changer. We're also looking at a lot of new blood tests. And so I'm lucky to be one of the pioneers in this field. And we started out in 2021 with Gallery. And it was a test that looks for 50 cancers. Unfortunately, it looked for 50 cancers in patients who are 65 and older, and it never was tested in firefighters. And so there was a lot of momentum, and we tried it in our population, and it wasn't super successful. I'm now doing some work with Cancer Guard, which is Exact Sciences, and it looks at DNA methylation, but it also looks at proteomics. And actually on Monday, we're looking at a company out of Cambridge called Proteotype. And this actually looks at your immune response. And so that's different than Cancer Guard or Gallery. Cancer Guard and Gallery both look at the DNA being shed in the blood from the tumor. And so if you think about it, in order for a cancer to shed blood or shed like tumor cells into the blood, it has to be stage 2 or stage 3. So for me to pick up a stage 1 or stage
Yeah.
0 cancer, it's got to be encapsulated, but there's still immune changes going on in your body. And this test called proteotype has studied that and come up with a blood test for it. So what we've done is we've got this huge biorepository of firefighters' blood and urine, and we've sent 20 samples to Portugal, and they ran them last week. And so Monday we get the results. And if it's very promising, it's something that we're looking at to bring to Vincier and continue to interrogate it and build it for firefighters.
Well, what would those results look like, or what are you hoping they
So
look like?
we gave them 10 cancers. So thyroid cancers, prostate cancers, kidney cancers, some of the common type of cancers that we see in firefighters. And then we gave them 10 normal samples. And we didn't tell them what was what. And
Nice.
so I want to see how successful they are. And so I think if they have a hit of 40 or 50%, it's worth bringing them over and giving them more samples and, really trying to refine the test so that it works for firefighters. The biggest problem is we don't understand environmental cancer very well, right? We understand old age cancer because that's what we've been treating for majority of the time. And now seeing cancer in 34-year-olds, 39-year-olds, and these rare cancers, there's virtually very little data, and it's hard to treat.
Yeah. So what are you seeing changing? What do you see as the trends in this? And obviously you're doing a lot of cancer screenings right now after Anthony Mock's passing. You kind of saw a surge, right? But what are you seeing as far as things trending? Are obviously guys like Jason and the Phoenix Fire Department, they're doing a lot of things to um, uh, give everybody as high likelihood as possible to not get cancer. But what are you seeing in the trends right now?
So I think the biggest trend is what you're saying is after Anthony Mock passed away and Scott Lethem passed away, there is this want to get screened. Prior to that, it was very much we had to kind of say, come on, get your cancer
Yeah.
screening. But now people are being more proactive about it. Also, I think on the toxin part of it, people want to know, what does this mean? I've been exposed to lithium ion battery fire. What does this mean for me? And they want to be safer. Decontamination is super important for them.
That's great. I mean, that goes to mindset. That's nice that they're worried about those things. We were talking about in the last podcast that I have a healthy fear of heights. So when I go hiking, I stay away from the edge. It's probably really good for me. I'm glad they now are to some degree really worried about getting cancer, and they'll now do everything possible. I mean, I guarantee you every firefighter knows another firefighter who's either going through cancer, had cancer, or know the guy that they lost to cancer, and that certainly helps
I think,
motivate them.
yeah, and
No?
the thing that's really interesting though is it goes in these ebbs and flows, right? And we talked about that, but sometimes events trigger people, it changes people's immediate behaviors. Firefighters are bizarre creatures in some respects. And
Oh, they like snap back?
yeah, or we'd sometimes rather bury our head in the sand, or we're conspiracy theorists on things. And so I'm kind of curious about those that struggle to get screened. We have a lot of people that it's available to them. You do a tremendous job. We're finding people, the data's out there that if you get treated early and you're going to do okay. But we still have a lot of firefighters that struggle just crossing the threshold of the building. Yeah. Do you have any idea what that might be and why, and what you might say to somebody like that's resisting being screened?
Yeah, it's hard because I think a lot of people are scared, right? A lot of people feel like there's nothing that they can do. And it's actually the older population that don't want to come in and get screened. If I look at my schedule for August, I have 24-year-olds, I've got 33-year-olds, 37-year-olds, and there's less of that 55 and above kind of, in that arena. And I'm thinking to myself, well, they need to be coming in the most. And
Yeah.
so I think it's the younger population is more into wanting to do detoxifications, healthy. They're very influenced by the internet and all of those types of things. And that older population is that tough population that,
Yeah.
that mindset of like, it doesn't matter how sick we are, we're just going to go to work, we're going to show up. And so I think there's definitely a gap in there, but I've had more fire chiefs come through, which sets a good example for the younger people. And so, I mean, I think it's just education. And what I try to say to everybody, it's a very safe screening exam. I don't do anything that I don't think you need. And I mean, I go through everything personally. So it's reviewed by an oncologist. If I think you need additional testing, I'll order that additional testing for you. But I mean, I try to make it as simple and flawless as possible. And so, and if there's something you don't want to do, you don't have to do it. Some people don't want to do the colonoscopy. People don't want to do the prostate exam. You don't have to do everything. You'll get the best results if you do everything, but you don't have to do everything.
I love it. I love it. You know, I think that's really interesting looking at the psyche of the fire service. I never thought about it in terms of generations. That makes a lot of sense that probably my generation, I guess I'm the old guy now that, we resist that stuff a little differently. When I teach in the academies, the kids, these guys are 20 years old, 19 years old, and they're asking, can I go down and get screened? So I think to your point, it is a little bit different. And I'd say to whoever's listening to this out there, first of all, unbelievably, you're a godsend and a miracle. You've saved countless lives already by what you're doing. Yeah. I had a cancer that was caught early. You guys, Dr. Pritchard cut it out, and we were back to work in weeks. Thank you for what you're doing. I just wanted to say that. But to those that are listening, if you haven't done it, if you have access to it, if you live in the Valley, please take advantage of the Vincere Cancer Center and the work that they're doing over there. It could be a lifesaver for you. So that's my public safety announcement.
Yeah, hands down. So Dying to Save You dropped. And I even saw firefighters in Ireland on a Facebook post saying that they wish they had a Dr. Shukla. What have you seen
That's awesome.
since? Oh yeah, in fact, I'll screen grab that because I want you to see it. These are guys, 7,000 miles away, and they also said that they don't have anything. There's no presumptive laws. They lost other firefighters to cancer. There's absolutely nothing they can do about it. There's no support for it. There's no laws for it. There's no cancer screening programs. They're just rural Ireland firefighters, and they get cancer. That's pretty much a death sentence for them. But so Dying to Save You dropped. I had heard through the grapevine you'd gotten some calls after the film. Tell me what kind of impact the film has had for you.
So, I mean, firefighters, you're right, from all over the country have reached out to me saying that they need this. And I've had firefighters from England reach out to me to saying, can they fly out here to get the cancer screening? And so what it's meant for me personally is that we have to take the program national.
Yeah.
And so kind of the universe aligned. A retired fire chief from Phoenix came to work for us, and he's perfectly positioned to help us take this national because firefighters shouldn't be dying across the country. This should be a right for firefighters. They risk their lives for us. They deserve cancer screening.
Absolutely, totally. When you heard from these guys from around the nation, and what are the things that they say? Are they like desperately looking for solutions? I mean, are they?
Well, everyone has a story of someone close to them dying and how they wished that they had access to cancer screening because it would have made a difference.
Yeah, for sure. So tell me about growing nationally. Like, how on earth do you even achieve that? That has got to be tremendously expensive. You can't be in all 50 states. How do you scale you in this incredible organization you've built? Because part of how you're able to be successful is because of the presumptive cancer laws that in the creation of the first responder cancer screening program and all these things. But how do you make that a template, or how's it going to look?
Okay, so my biggest yield for finding cancer is the whole body MRI. But I've been doing serial whole body MRIs since 2019, and I've collected this whole database. And so next week, I'm actually meeting with the NIH and their AI specialist to try to take this because I know things that people don't know. I know which kidney cysts actually turn into cancer, which, when an angiolipoma is not really an angiolipoma, it's an early renal cell. So there's things that I've just followed in firefighters, and they've turned out to be cancer, and I've followed this over years. And so our goal is to try to feed all of this data, as I accumulate more and more, into a big database and do AI learning from it, so we can help everyone, and just not just firefighters, but it'll also help younger people are getting cancer all the time. They're getting the same types of cancer as firefighters, just not in the same amount. And so hopefully that's one thing. Looking at these blood tests, and really, we have 4,000 samples in our biorepository.
Wow.
But as I continue to grow my program, we're going to be seeing some firefighters from Utah, some from California. It's going to get bigger and bigger. And working on a specific lab test that works for firefighters is going to help. It's going to be cost effective. That's
It's
why
like blood work.
it's like blood work, but it's looking at the immune markers. So that's another area that I think those two tests, if we can come up with some AI software that we can utilize, anyone gets an MRI anywhere, they can send that data over and we can analyze it, we can give them more information and feedback about their health. And so those are two big steps that we're taking. There's also another company that we're working with. We're in the very early stages. It's called See the Signs, and it's an AI company that can go through all of your different symptoms and predict cancer at a higher rate. And they did this at Mayo Rochester, and they picked up like ridiculous amounts of additional cancer. And so now they're at Kaiser, but we've been talking about doing this for firefighters, because what happens is I'll meet with a firefighter and they're always good. And then later they'll be like, oh no, I forgot to tell you, I'm having abdominal pain. I can't breathe. They're not the best historians.
Yeah.
And so something that they can kind of plug symptoms in and we can kind of monitor them will help.
Interesting. But so you want a Vincere Center in like all 50 states, right? Or are you just going to go for big cities? Like, what would be like crawl, walk, run here? Like, what's the what do you want to see at the end of all this, and what's like the first steps to getting out of this state with it?
I mean, I think for us, the first steps is trying to build out the technology a little bit more and politically being in DC, because we could get the attention of a lot of people. They can see what good cancer screening is for firefighters, and they can see the outcomes and how meaningful it is. And so that's we're looking at kind of starting out there. And in the meantime, in the background, I'm trying to work to get all the technology and everything set up so we can really scale.
Wow.
Is it helpful for your business model and for what you're trying to do for the fire community, the legislation that's being passed? So when states, because it's sort of like a domino effect that's going on around the nation right now in terms of presumptive cancer laws. Some have better than others. I think we're doing a pretty decent job here in Arizona. But is that helpful for you in terms of if you wanted to replicate this somewhere and they have really strong presumptive cancer laws, would that help support your process better?
100%. Because
Yeah.
I think Brian Beck passing and Brian Beck getting benefits was one of the main reasons my cancer screening program exists, because the payout for a young firefighter dying is so much. And so it makes sense to invest in their well-being.
So would it clearly you've thought, and obviously the issue is immediate and current. Firefighters are dying of cancer. They're getting it young. They're getting rare cancers, and it's an awful situation. Like when you roll this out, like do you envision like you've got a massive facility stuffed with incredible capabilities and super smart people? What do you envision that being replicated all over, or like smaller versions of Vincere, maybe blood test based, or
Yeah, I think
what do you
smaller.
see?
We obviously at Vincere we do a lot of cancer treatment, so we've got the surgery and the radiation, but that doesn't have to be everywhere. We just have to focus on the cancer screening. So having a basic MRI, some basic exam rooms where they can do skin cancer screening and where they can do some blood testing. They could send all the blood to our lab and we could run the test. And so, not huge like us. We just need small centers where firefighters can go.
Interesting. When you got started on this path, I remember I remember when I interviewed you years ago. It was the 9/11 cancers, right? That kind of
Yeah,
made you look into this whole thing. You couldn't have possibly thought like it would be gone this far now,
I
you
know.
know? It's like the next things just keep unfolding in front of you and in front of Vincere. I mean, what a testament to what you guys are doing to have firefighters from all over the nation reach out to you. We don't have you here, help us kind of thing. That's really just, what do you think about all that?
It's life changing. It really is. I mean,
Have you ever felt more important?
honestly, it makes me feel super important, and I love it, and I love them. It's so bizarre. I think of all the firefighters in Arizona as mine, and they're all my patients. And yeah, it's Anthony Mock is like, this is what God told you to do, and I was like, I kind of never really thought about it because it just fell in my hand and it got busy, and I was like, It's probably is. It's faith. I had this was going to be something fun for me to do. I had a high end breast cancer practice, and now all my patients, most of my patients are male, and yeah, the firefighters, they're the best group of patients I've ever taken care of.
And you are really well known now. I mean, there's no firefighter that
You're a big
hasn't heard your
deal.
name.
You're
Yeah.
a really big deal.
Yeah. I mean, and
How'd you land her as an interview?
I don't know, Ben. Thank you, Ben, over there.
Thanks, Ben. Well, one thing I'm going to say that I'm inspired by is that even though this is a bigger venture maybe than you thought it was going to be, it hasn't outgrown your vision. Like your vision is, we're going to keep marching. We want to go across a nation and the world. Like I love that you're still pushing and you're still trying to push this to the end. To push the envelope to help more people and bring more in. And I want to
Go
speak to
take it away.
something just. I was thinking about this when I knew that we were going to have this conversation today, and this might sound really weird. I hope it doesn't come across wrong, but sometimes it's hard to picture the doctors that are treating you as emotional human beings, right? How does this, like you've treated so many, some of them, you've been with Scott Latham and with Anthony Mock and with other Ricky and those guys earlier, Brian Beck Jr. and that didn't have great outcomes, and then others that do. How do you keep doing this? What drives you? This is we feel the ache and the pain, and it feels like so much more to you. But you're a rock. It seems like. How do you handle that? How do you manage it?
It is hard because, so with my regular cancer patients, I know when they're going to pass, and I have fabulous relationships with them, but I always put a little bit of distance. Firefighters, there's that brotherhood and there's that connection, and I never really understood it. But Anthony Mock had to talk to me every day, and so every day at lunch we would just talk, and you just become part of their family. And so when he died and his funeral day, and I was like, I'm going to see firefighters because that's what I need to do, and that's what he wants me to do. But yeah, it is very different, but it's at the same time it's motivating because you don't want to go through that again. You don't want to have another young 39-year-old, and you were there for Scott Latham. It is very, very hard.
The reason we're making this, I don't want to see another firefighter being taken out of their home with a flag draped over their body. I can never see that again in my lifetime. And when you see the months of endless grieving by Ashley Latham and Caitlin Mock and the things that they post and the things that they share, and even Monica, all 5 years later, it's just obviously it's inspired me to make the feature length film because Dying to Save You has been circulated amongst firefighters, and that's great, and that's incredibly effective, and it's making the conversation going, but the general public is still largely in the dark that their first responders are paying this type of price, and that's what this new movie is. That's why it's feature length, because in general the public doesn't watch short films. Nobody says, hey, tonight let's throw on a great short film. It never happens. People watch feature length movies. They want something they can get involved in for an hour and a half, 2 hours, and obviously that's what the new film is. But I'm hoping that there's somebody out there who's going to go, I got an idea for a better set of turnouts for firefighters, a different material or fabric that I've been developing for some other completely different thing that might be a good solution. Like the more people that know, the more interesting things that could be brought out of the
100%.
the woodwork. And maybe somebody with a will want to take a swing at other aspects of the issue to help reduce the amount of firefighters getting cancer. And and I learned about Jason's storm stick today. He has developed a product because everybody, like, you feel like you just want to do something other than saying I'm sorry for your loss.
Yeah.
And Jason took his frustration with the situation or his concern with the situation and is like, I'm going to try to develop this thing to so the guys can get cleaned up on the fire site, and that's great. But think of how many more Jasons there are out there. Jason became a freaking inventor. He's a fire chief, and he became an inventor of a product, right, to help the cause. What happens when 1 million people see this new feature film? Random cool things are going to happen. We don't know what they are, but I feel more progress will be made.
Yeah, and maybe just more funding to do more research,
Simply
more
that,
screen, more people.
Yeah.
Which pushes the ideas. And I think to that point, like, I'd love to hear, you mentioned a few things because you do a ton of research. I get so excited when I'm sitting in some of those meetings you guys allow me to be part of about what's on the horizon. What are some things that you're excited about that we may be able to find out in the not too distant future that we don't know right now? What are some of the things that you're in the process of trying to learn that you think could have a positive impact on the fire service?
I mean, I think our work with Harvard is super important.
Yeah.
You've been on a lot of those meetings, but it's not just looking at the toxins, it's looking at the physiological or the pathological effects those may have on a human being, which we really don't know.
Yeah.
And so even though it was like a production to test the titanium guys, it's worth it for us to start to learn these types of things and being able to do microplastics. And Jason is our first guy who got microplastic testing.
Really?
Yeah.
And so
Did they find a whole Walmart bag where
Yeah,
the
there's like
plastic?
yeah,
in
like
it?
6-pack of
Yeah,
the little holders
yeah,
in there. No, it was interesting. I don't want to. I don't know how much. I don't think if I'd say it, there's HIPAA laws. But my wife and I both did it, and I had like 2.5 times the microplastics that she did in her system. I'd love to have you take a look at it, but I don't really know how to make sense out of all of the stuff quite yet. We're still working through that, but that's the kind of research I think layered. We have these things like microplastics weren't really on our radar maybe 5 years ago or 10 years ago like they are now. Neither was the fluorinated chemicals like the PFAS chemicals, and there's white matter studies that you're doing, and so I think what's cool is you're layering all of those and you can see what the complex relationships might be between many of these different systems. And I think there's just some really, really good research that's going on.
AI is going to be huge for you.
Absolutely.
I mean, and you know that because you could take 10 different data sets, drop it into an AI, and it's going to find a pattern or a connection that you didn't see, or maybe you'd have to study it for a friggin' month to go, wow, when that than that, but AI is just so good at that. I'm glad you guys are going to be doing that to look at the data.
Something that Jason mentioned is we see a lot of white matter changes in firefighters.
What does that mean exactly?
And so
for
in the
layman?
brain, there's the brain has these white matter changes that can develop. It could lead to early dementia. You see it in people who have Parkinson's, you see it in
MS, that kind of thing, yeah.
but you also see it in people who do jiu-jitsu. So Chandler Fire does a lot of jiu-jitsu and chokes themselves. And so,
Wow.
but I've started to see it in ketamine. And so because I begin to wonder, but microplastics is also causing white matter changes and the accumulation in the brain. And there are some firefighters who undergo ketamine or who have severe PTSD that I truly believe causes the white matter changes, but a lot of them don't have any. And so I have to believe that that's microplastics. And what is the long-term side effects of this? So there was a recent New England Journal of Medicine paper that came out with a group that we're working with Harvard and showing all the accumulation of all these microplastics in the brain. It's scary.
Wow.
Yeah.
So in your role as a radiation oncologist and someone who's super passionate about the topic of firefighter cancer, how what's how would you sum up your month? You spend like a third meeting with patients and a third doing looking at MRI scans and stuff like that, and like a third doing research. Like how does it all break down? How much of your time is spent on the research component? Because clearly that's important. You can't just treat cancer. You're trying to get ahead of stuff here.
Yeah, so I look at the entire cancer screening program as research. Every single firefighter that comes in, I try to learn as much as I possibly can about them. I look at all their images and try to really try to understand what's going on because I see different trends and different things. And so and again, they don't give me a lot of history, so I really have to interrogate them, right? Because we see a lot of fatty liver, and we see a lot of fatty liver in young firefighters, and they don't drink and they're fit. And so I have to assume maybe it is microplastics, maybe it is PFAS. And so working with a lab like Harvard that is going to give us access to all sorts of testing is going to really help because we just don't know.
Interesting. That's super cool. Because I would have thought most, obviously you excluded, like a traditional primary care doctor who has some cancer experience is not as invested as you guys are in trying to just unpack the problem and make the connections. And but there aren't a lot of people like you, are there? I mean, not in the occupational cancer for firefighter space. Is there another? Who's the number two to you?
Yeah, there's not a lot of people doing what I do specific for firefighters. There's a couple clinics opening up, and so actually this past week, Betsy O'Donnell out of Harvard, she is opening up an early detection cancer for firefighters, but mostly it's a direct referral for firefighters who have cancer, and I'll be working with her on that and trying to get second opinions for some of our firefighters and things like that, and then perhaps at some point do a lot of early detection work with her. They've had some problems with utilizing MRIs at Harvard because they just have a lot of sick patients. And so nobody wants to dedicate an MRI to cancer screening at this point there. And so, but she's done a lot of work with a lot of different liquid biopsies and early detection assays. And so she's got a lot of knowledge. And so that's a really positive step forward for us. There's also another trial being run out of University of Virginia, but they've only enrolled 100 firefighters. They're doing whole body MRI versus whole body ultrasound to kind of look at the different changes. Utah is going to start trying to get a cancer screening program up and going, but the whole field of early detection is evolving. So there's more and more medical oncologists and radiation oncologists heading this way, trying to understand early detection, realizing that the cancers, it's increasing like crazy. And so think about it. 100 years ago, 1 in 38 people get cancer. Now, 1 in 2 people will get cancer. And if you're a firefighter, you're 15 to 20% higher than that. And so it's scary. And so we realize we have to put a lot of resources towards early detection. And so firefighters are some of the highest risk. It is the highest risk occupation. It's, military is a short period of time. There's nothing where you're exposed to this many toxins over such a long period of time.
Decades, yeah.
Weekly for 20 years.
Yeah. Lack of
That's what a
sleep,
firefighter-
stress. Yeah, in my opinion, it is the worst occupation.
We've got I love what you said at the beginning. We've got a Dr. Shukla. Everybody wants a Dr. Shukla. We got one. I love it, and we're so thankful for that. I'm curious from your perspective. Are there things I kind of subscribe to the simple like an ounce of prevention is worth a pound of cure. What are there things that you feel like if the fire service got really good at, it might help curb some of this? So there are things that firefighters can do or should be better at doing that would help with potentially with some of these numbers, because that's what we talked about with you and I, is like pushing back on this. When do we start seeing the numbers change? How do we do that? What are the big things that firefighters can do?
I think for me, your decontamination has to be the most important, serious thing you do, because there's cancers like brain tumors. Some of these brain tumors, they're not treatable. Something like a Scott Lethem, I can't fix that even if I detect that early. And so, I have another brain tumor from Tempe that's a horrible one, and those are ones that there's very little treatment for. And so I think being as careful and respectful of this is these
The
toxins are,
hazmat
yeah,
zone. Yeah.
just be very, and decontaminate and be smart about things and do your cancer screenings and try to be living a healthy lifestyle. Nobody's perfect, but
Yeah.
everything helps.
Yeah.
Yeah. It's like adding up all the advantages. If you stay healthy, avoid the things that cancer loves, and do all the steps, you could probably considerably reduce your chance of not make it go away, but to reduce your chance. And that's the difference between, someone still being alive or not. It's um what so obviously a drum that we've always tried to beat about is to go to your cancer screen no matter how you feel. How many guys are you, or firefighters are you finding with cancer that had no symptoms of any kind? I mean,
So I would say 95% have no symptoms.
Wow.
Majority that come through, they're healthy and happy, and which is great because most of the time I'm finding it early. They get surgery and they're back to the truck. It's the odd one who will come in and say, "Oh, I haven't had a neck in my mass. I have this big mass in my neck for a while. I haven't done anything about it. Can you help me?" Or one guy is like, "I've been peeing blood for a while and I've been meaning to come in, but it got busy and.
Gosh.
And so, but majority are just trying to come in and check the box and do the right thing. And so,
and then surprise.
Well, and I think we talked earlier about, the for those that are resistant, but for those that aren't, I think there's a huge message in there is that when you show up before you have any symptoms, that's when you need to go get screened, when you don't feel bad, when everything feels all right, because if you can catch it then, chances are really, really good that we can get this thing fixed and get you back on a truck. And that's
100%.
cool. Yeah. That's
Yeah.
awesome.
That's crazy. Just obviously everybody's just grateful for the intense work that you're doing. I don't know anybody who knows you like personally, like you're Dr. Shukla with Vincere Cancer Center, and you're working your tail off on firefighter cancer. Do you have any hobbies?
a lot of hobbies.
Really?
I love to shop. I love
Right.
to interior design. I love to travel. I like to cook, but I don't cook.
Wait a minute. How
I guess I cook patients for a living. I'm a radiation
Oh, yeah,
oncologist.
right.
So I don't,
Okay.
yes. But so, because I need a lot of downtime. And so I like the arts and going to museums and those types of things because it distracts me.
Yeah, gets you out of your head. Do you have like any kind of? I'm just gonna get all personal here. Do you like I'm not working after 7 p.m. or what like boxes do you
Boundaries,
draw on boundaries just for your own? Because obviously, you're in a fight here and you're doing a lot and you got to stay 100%. Like how do you keep from
Well, so
burning up
you
in the
know,
atmosphere?
during Saturdays and Sundays during the day, like I just, I'll do a lot of paperwork. I won't respond to a lot of patients unless they're super sick. And usually it's easy for me because it's something simple that, they're struggling for something and I can fix it very easily. And so those are things that I like to do because it's easy. And so, I don't have to go to the hospital to do call. I don't take care of ICU patients. And so, yes,
And
I
you do paperwork from home?
no, I like to go into
you go to the
because
office
if I
because you separate it.
yes, because if I'm at home, I don't do anything. The paperwork that should take 2 hours takes 8 hours. So, yes, no. So I try not to work from home. I'll answer text messages and stuff, but yeah,
Everybody always says like they'll text you on the weekend, you get back to them. They text you in the evening, you get back to them. Everybody's under the impression you're like 7/24, but you do have your life in there, and you
yes,
have to have that
yes.
balance. But
Well, firefighter, and that's something that's unique about our culture. There's not a lot of jobs where you're just used to working around the clock, and I don't think firefighters are on duty on Saturdays. They just think I'm at work. Everybody's at work.
Yeah.
It is kind of weird some of the expectations there too. So I'm glad you.
But a
protect
lot
some
of them
that.
are my friends, and so
Yeah.
they'll text me weird stories and memes and jokes and gossip and what do I think about this fire. So they're very entertaining, and so I actually enjoy hearing from a lot of them, and so.
that's funny.
Awesome.
I like always have trepidations about texting you ever. It's just like is I figured you're in the middle of something and I don't want a text to show up and you're just like, oh, I could have waited or something like that. So there's been times I just like hold off because I don't want to bother you
So,
because you're so
in
important.
terms of like physician jobs, radiation is a good job because it's a day job. And most of my
True.
cancer patients are young, healthy. I'm treating early stage breast cancer, early stage prostate cancer. Every once in a while, I'll get a sick head and neck cancer. So they need care, but they're not overly consuming. Majority of my firefighters are well patients. Yes, every once in a while we get some really sick ones, but they're
Well,
entertaining.
patience.
They are.
Yeah.
They tell me
Yeah.
a lot of interesting stories. I learn a lot from them. And so it's good because they're very different than the cancer patients. And so it's a good mix for me. It's a good balance. Um,
You're like a
so
therapist too, aren't you? You're kind of like
well, I'm
Yeah.
very good in dealing with like the cancer diagnosis and what that means.
yeah.
But sometimes the PTSD
Mhm.
and things like that, when that happens, I'm in a different
Yeah.
ballpark for sure.
Yeah.
Yeah. Yeah.
Where do you see the future of your line of work? Are you optimistic about the changes that are happening? Are we progressing at a speed that's catching up to the problem? And where do you see the next 5 to 10 years of cancer in the fire service? Is it going to get better? Is it going to get worse? What are your thoughts on that?
So I think there's still a group of firefighters that are really high risk because they were the group that still they weren't properly protected, right? They didn't have the two sets of turnouts. They didn't do decontamination. They only did that for the last 10 to 12 years. And so they have years of exposure that is adding up and causing issues. And microplastics causes heart disease. And there's all sorts of things we're learning about in PFAS and the thyroid and all these other issues that we're finding out. And so I think there's this still really high risk population that needs to come in and make sure they're staying on top of their screenings.
So then, could I also assume, and this goes to a question I thought you asked when we were talking, is does that mean that this younger generation is in a different place? You see them differently in terms of the last 5 to 10 years of people that have come into the fire service?
Absolutely. I mean, I think Phoenix Fire does a great job educating everybody that this is a program that we have. Do your decontamination, get your cancer screening. I have so many young firefighters, and I ask them, "Why did you come in?" "Oh, someone told me to come in and be safe." And so they're trying to be smart and they're trying to be careful. So they
That's
understand.
encouraging. Yeah. No, I think, and the question I think about a lot is when are we going to start maybe
Yeah.
seeing a trend where the numbers and the data is going to be encouraging for us instead of discouraging. And it's good to at
Well, it
least
sounds like the
hear,
percentages are going to jump based on new data and old statistics. It
yeah, that
sounds
it's
like
going to
it's going to be
continue
like,
because there's that latency, right? There's just
yeah,
that group of people,
yeah,
but on the horizon is a new group of people and a new mindset and a
yeah,
new education and new tools and new understanding. So to me, that's I'm trying to find a reason to be encouraged in that,
Yeah.
and I
yeah.
think
Well,
there's
the
something
culture
there.
has changed
Yeah,
and training's changed and awareness is now changing dramatically and we're not letting up on awareness.
yeah,
We're not letting people forget about firefighter cancer,
yeah.
and
But Jason, don't you think like decontamination is so much better than
Yeah,
when you started and it keeps getting better
yeah,
every day?
yeah.
We all get smarter
yeah,
about it, and so I think we're just doing a better job.
yeah. Personally, with our gear, even with the trucks and tools and the stations, station designs and truck designs, how we're yeah, I agree with that. I think all that goes into decontaminating ourselves, our gear, and our equipment is getting much better, and people are doing it, and that's the difference. I think that to your point, the people that struggle the most with it are the same people in that category that didn't grow up learning that stuff, and so we are getting better at that. Yeah, there's reason to be optimistic.
You're a very optimistic guy,
Thank you.
Jason. I am. I
Try
am
to
as
be.
well. But it's also hard to look at if it feels like this slow motion car crash, and hopefully the cars will stop crunching together at some point, or
Yeah, we've got to do it. You
be
got to do
less
the work.
insane levels.
In the research community, are you? Do you feel like there's just so much that's left to learn? Do you feel like we're getting a handle on some things?
I think we're learning a lot.
Yeah.
I mean, we're lucky we have Jeff Burgess here.
Yeah.
He's phenomenal. I mean, there's
He's going to be in
nobody,
a new movie.
yeah, there's nobody better than him.
Yeah.
He's done this for years. He's got a huge biorepository, and he's been collecting firefighters all across the country. And that's supported by the American Cancer Society. And so, I mean, his work is instrumental in understanding toxins and how that relates, decontamination, all of those types of things, which I think is going to change laws, is going to
Yeah.
change. I mean, his work made the designation of firefighters as carcinogenic. And
Yeah.
so that type of stuff is important. And so he keeps pushing me to publish and he's supporting me to do it. And so I'm going to do it.
And a tremendous human being.
Yes.
Jeff Burgess is just such an incredible human being too. He was out. Yeah, he went out to the California fires recently. He's working in San Francisco on some studies.
I
And
wonder how
guys all
many
over the place.
cancers that's going to create.
But having the research and having the ability to capture that information is going to really propel some work in this space. So thank you guys for doing all that. That's cool. I think it's great.
Are obviously you look at a lot of data. Are there any like drinkers versus non-drinkers, people who work out versus not work out, or people get seed oils versus not? What are some things that seem to stand out in the data that exist in firefighters who end up with cancer, other than the fact that they're
Lifestyle
firefighters and
stuff?
getting what lifestyle stuff is maybe contributing? And maybe you could create a top 5 list of things that if firefighters avoided, it's probably a really good idea or reduced.
So I think the number one thing is sleep. They don't have a sleep plan. Almost every firefighter who I've diagnosed cancer in, poor sleep. And so I think they're immune deficient. They will complain. I mean, they complain during their cancer treatment that they can't sleep, but they say, oh, this has been a chronic problem for me. I also think mental health. So there are firefighters, even when they're getting their cancer treatment, I will make the suggestion, well, why don't you speak to somebody? Oh, I don't do that. But that weighs on your immune system. That weighs on your health. And I mean, I had
Cortisol is flowing.
I had a retired Phoenix guy I seen yesterday. And so I was like, you've been on for so long. Have you ever talked to anyone? He's like, oh, I don't have those issues. And then I called him today and he was like, I actually had PTSD at the dentist. And so he was seeing some kids from a fire that were burnt. And it's, I think we probably need more preventative but I think that also contributes. I think those probably, and then I think there's still those, that young group of people that played in the foam and they can tell you, I mean, a lot of these guys will tell me, Tommy told me about a horrible asbestos fire that he was on, and Anthony had horrible fires, and I remember Scott Leatham telling me about a horrible, like they will have something that was very, very bad that they could, and it could have been that incident, I don't know, but they will tell me, oh yeah, I remember being really sick after that, and so
sleep,
mental
health.
Yeah.
What else should they keep an eye on or keep in check?
I would think I would think trying to do your decontamination type thing as well. So those would be my top. Most of them are pretty good about their diet. They want to be healthy. Most of them exercise. And so if I had to pick kind of my top 3 things, those would be it.
And you know what I think is fascinating about what you're saying, because that was not what I expected you to say. That's pretty cool. Is, I think firefighters, we may not be great at having at our diet, but we know what a good diet is. We may not be great at an exercise program, but we know what a good exercise program is supposed to be. I think when you start talking about sleep hygiene and mental health, those things, I don't think we know a lot about that. I don't think there's been enough education and enough support in helping members know what it means. It would be great if it's like, yeah, I know how I should be sleeping. I'm just not doing it. But I think we're just floating down the river, taking the beatings as it comes, and then saying, yeah, I haven't slept in months very well. so what I'm hearing in there is room for us to be able to educate, to be able to fill in some of those gaps, to provide some tools to members. And if we can close those gaps, that would be great to be able to know that there's a link there.
Absolutely. I think if we could improve sleep, that would make a huge difference.
Yeah.
If you don't sleep for months and you don't sleep for years, and this
Yeah.
becomes chronic.
Yeah.
I was the world's worst sleeper up until I quit drinking. And when I cut sugar out of my diet completely, I do no sugar, no carbs. And that had such a profound effect. I sleep like a 13-year-old now. I literally go to bed at 9 o'clock. I wake up at 4 o'clock. I feel like $1,000,000, not getting up all night long. And it's made it dramatic. So anybody out there who wants to get their sleeping in check, consider throttling back on the booze or just cutting it out entirely. I just can't believe what a difference it made in my life to not. You probably know what alcohol does to the brain more than I do, but what a difference that made.
Yeah, that's a firefighter diet is candy
Yeah,
bars
I
and
know. I may
booze,
get
right?
it. Yeah, right?
That's how we survive.
Yeah,
Energy bars.
I mean,
energy
but there's
drinks,
some
and booze.
amazingly fit,
Yeah.
healthy, like firefighters. I mean, Anthony Mock was
Yeah.
super fit. Scott Leatham, super fit.
Yeah.
He ate very healthy.
And didn't drink. Yeah.
Yeah, but, and so
Yeah.
Yeah.
Well, I appreciate that. That's cool, especially, in the role that I have overseeing some of this stuff. I think hammering the sleep and the mental health, that's kind of the buzzword right now. Everybody's talking about this stuff. We
And
understand.
sleep and mental health are tied together too. If you
Yeah,
don't
absolutely.
Sleep well, and
But
you're
understanding that it's
chronically-
all tied together.
It's all tied
This
together.
this is a web, and cancer is not just an isolated issue. It affects sleep, and it affects your mental health, and it affects your diet, and it has all, and vice versa. These things have this. It's all interconnected, and I think that's really important for us to
well said.
understand and to try to. We're not just pushing back against one issue. We really have to take a holistic approach to this. So
yeah, I think those are the two biggest things that compromise their immune system.
yeah.
Interesting.
That's
Is there
great.
anything we haven't talked about today that you would love for folks to know?
It's a wide open
I
question.
know,
Where do you go with that?
Obviously, you have a lot of stuff going on. I just want to allow you this platform to share.
I mean, if you have the opportunity to get cancer screened, do it. And if you don't want to do it for you, do it for your
Yes.
family.
Yes.
One of the Chandler fire chief who's super amazingly fit, he eventually went through the cancer screening program, and he called me and he said the best reason why he did is his wife was so relieved after that. And you just don't realize it. For years you're exposed to toxins, and even though you're super fit and you take care of yourself, you're still at risk.
Yeah.
Yeah.
And if there's a son, daughter, husband, wife's friend out there that's listening to this, go nag your significant other, push them there. That's a reason. I think firefighters are better at taking care of other people or doing things for other people than we
Totally.
are
Well
about
said.
taking care of ourselves.
Yeah, hands
So
down.
if we know that this is something we're doing for our kids, for our family, for our, for people that care about us, we're maybe more prone to do that. So very well.
Yeah,
very
one
well
of
said.
my favorite things is I screened a young Phoenix firefighter, and as he walked out, he scheduled an appointment for his dad,
No,
who's on the
that's
truck,
awesome.
who's never came through.
That's awesome.
It's so funny. It's like they'll kick in doors and run through flames, but I'm not gonna get a cancer screen.
Themselves. Yeah.
It's like
Yeah.
you guys are all just wired weird, but
We are.
we love you.
Thanks.
Dr. Shukla, thank you for coming on today and sharing your wisdom and all the stuff you have going on. We'll definitely have you on again.
Absolutely, thank you.
All right, we are out.